Good afternoon, everyone, and thank you for joining us today for our webinar on contact tracing for senior care. I'm Sarah Haskell. I'm the Director of Marketing for Fully Managed. And before we get started, I just wanted to remind everyone that you are muted on the call. If you do have questions as we go through the content, please feel free to use the Q&A section in the dashboard to submit questions to us. I think to start, first off, we'd really like to say thank you to just a quick update on Fully Managed. Oh, Jerry, could you advance the slide? Anyways, I will continue. Hopefully we'll get that sorted out. Apologies. There we go. Just to give you a quick update on Fully Managed itself and what's been happening on our end over the last few months. In case you didn't recognize the Fully Managed name right away, we were formerly CareWorks, and in June we formally adopted our new brand. So that is a bit of a new thing, but we wanted to let everybody know that has happened. We're still the same team and dedicated to serving the technology needs of the senior care sector. And I think over the past few months, now many of you might relate to some of the things that I'm going to mention. We've really been working on helping customers adapt to the new normal that COVID has presented to everyone, and most specifically to this sector. We've been helping customers do many different things, from helping them to find devices to enable seniors to stay in touch with their families, raising awareness and providing education about cybersecurity threats that have targeted seniors and senior care facilities specifically as well. Even helping some of the, I guess, non-essential on-site, non-on-site, hands-on, care delivery staff, helping them transition to work safely and productively from home, because quite frankly, there weren't a lot of people that were prepared for that. We also, as a team, felt the need to do a little bit of what we call grassroots work, and to find small ways to kind of lift the spirits of everyone in senior care. And we started a movement called Say It for Seniors, which was a website that we have to share messages of kindness from people all over, maybe to bring some smiles to some people who really need a break. We also participated in a movement or a program called Moments for Care, which was virtual music concerts for senior care facilities to basically thank caregivers for all that they were doing, and to, again, just bring a smile to some seniors who may be feeling a little isolated. More recently, some of our discussions have turned to, fielding questions about getting prepared to set up things like telehealth, and, I guess generally how to be better prepared for tomorrow. And that kind of brings us to today's topic of contact tracing. Obviously, it's a big concern. Infection control is, a hot topic right now, and has been for the past 4 months. And contact tracing is a big component of that infection control strategy. And we've been talking to a number of different customers over the last few months who've been really, challenged with what I guess were traditional kind of manual methods of contact tracing, perhaps drawn from public health scenarios that aren't just aren't working right now. So with that, I'm going to hand it over to Jerry Wilmink of our partner CarePredict, who's going to take us through the topic in a little bit more detail and talk about their own Pinpoint solution for contact tracing as well. And just to let you know, Jerry wanted to make sure that everything was going to work today, so I don't think he's going to actually turn his camera on just to save some bandwidth. But Jerry, with that, I'll turn it over to you.
I will share my camera just to say hi.
Hi, Jerry.
To see everybody. But yeah, I'm going to conserve the bandwidth and just have the presentation running. So thank you for the introduction. I really appreciate it. Okay. Well, good afternoon. My name is Jerry Wilmink, and I'm the Chief Business Officer at CarePredict. And I'm really excited to present today really our latest product offering, which is called Pinpoint. And it is a fast and efficient digital contact tracing tool built specifically for nursing homes and senior living facilities. These have been very difficult times for our customers, both the senior living communities and also the seniors themselves, as most communities have been locked down to protect the health of senior residents from SARS-CoV-2 infections and COVID-19 outbreaks. We've really put seniors in a place where their physical, emotional, and even spiritual health has been really struggling, a really difficult time where, for instance, outside visitors are not allowed to come and visit with their residents, with all the loved ones in these communities. The seniors are not allowed to participate in the social activities that they initially had signed up for. So with our tool, it's really not just a tool to control and mitigate the spread of SARS-CoV-2, it's also to empower those residents to get back the life that they once had before this pandemic hit. I've broken up the presentation into a few pieces here. So initially, I'll set the stage and introduce you to CarePredict, the work that we do, the products and services that we provide to senior living communities in the US and in Japan, and also to home care and for seniors aging in place. I'll then introduce you to COVID-19 in long-term care facilities, the challenges, some of the nuances that I think the media is not really touching on that make it particularly difficult to control in these congregate housing communities. Then I'll dive into the conventional tools and methods that we're using to control SARS-CoV-2 infections and spread inside these communities, including symptom-based monitoring, PCR testing, and manual contact tracing. And I'll also go into some of the digital contact tracing solutions that big tech has introduced that are also showing limitations in this particular setting. And then I do a deep dive on our latest Pinpoint solution and how it can be used by staff within seconds to rapidly identify potentially exposed individuals, both staff, residents, and visitors, that may be in fact asymptomatic at the time, and so they can be isolated and resources can be spent so they can be tested and outbreaks are mitigated. And then I finally will conclude the presentation with some of the late-breaking work. We've developed a SEER transmission model, which is a compartmental model to look at SARS-CoV-2 transmission in nursing homes and long-term care. We've also submitted this for publication to Public Health Journal. And then I'll close with some of our customer case studies. CarePredict was founded in 2013, and we've been operating for 7 years, and founded by our founder and CEO, Mr. Satish Mova, who is a veteran in this industry in both senior health and also in the technology industry. We're most known for our continuous monitoring solution, which consists of a wearable device, a beacon technology, and our deep learning platform that makes predictions on when seniors are showing changes in their activities and behavior that can be used as precursors for when they're at risk for a health decline, specifically a urinary tract infection, depression, or even falls. We have very strong intellectual property in this space, and we've been developing and commercializing the products in senior living, home care, and we also launched the product for in-home use in 2020, and that was BC, before COVID-19. We have proven results. We've conducted with our customers a 24-month outcome study that was submitted, and it's under review at JMIR Aging, where we demonstrated after a 24-month period with just under 500 residents that we lowered the hospitalization rate of those residents that use the CarePredict solution by 40%, which is quite significant, and also dramatically reduced the monthly fall rate by 64%. We've received numerous awards, which we humbly received from the Digital Health CB Insights Committee, CES Innovation Awards in 2020 as an honoree, and also selected as a 2018 top AI company in the world. We are very, very fortunate and excited to continue to work with Fully Managed, formerly known as CareWorks. We also work with Startup Health and the innovation team at Direct Supply, Aging 2.0, and have done some work now with Right at Home in the Detroit area in particular. When people hear of CarePredict, the first thing that really comes to mind is that we have a machine observation system. And machine observation system consists of this wearable device. This is version 3 in the lower left-hand corner. You can see it with the blue band, and a beacon technology. And what the system does allows us to measure the activities and behaviors of a senior autonomously and identify when deviations in those behaviors are occurring. So the system, if you look at the wearable device on this individual's hand, it actually can pick up when that senior is bringing food from table to mouth and identifies their personalized eating gestures based on the angles of their forearm, wrist, and yaw rate. After a 2-week training period, it learns all of their different gestures that are key to their activities of daily living, their general physical activity, whether they're eating, brushing their teeth, taking care of themselves, bathing, and even sleeping. After that composite set for 2 weeks, the longitudinal data and that baseline is created, and the machine can pick up subtle changes in different activities and behaviors. And this is a plot here of eating duration. So you can see as the eating duration dipped 1 or 2 standard deviations, it's outside of their baseline, and this can be flagged and sent to the staff who then can conduct an assessment and provide updates to their care plan. Things were marching along quite swimmingly in January and February, and then COVID-19 and the pandemic really hit. From the date of the first case up in the Washington area and some of the nursing homes and long-term care facilities that were impacted by SARS-CoV-2, we knew that this was going to be a significant impact to our most vulnerable, in particular residents in long-term care. What we now know is the residents of long-term care in nursing homes and in assisted living communities, 2 to 2.5 million individuals live in these environments, which basically is 0.7% of the US population. And what we've seen from that population is they comprise 43% of all fatalities resulting from COVID-19 illness. So they are disproportionately impacted by SARS-CoV-2, and we need to protect them. This is not surprising, given that from the beginning we've known that advanced age and underlying comorbidities puts individuals at increased risk for severe illness. And what we found even in the US is that 80% of all deaths from COVID-19 are adults 65 and older. This problem is compounded in high-risk settings such as a nursing home or assisted living, and that is due to the nature of the work. Facility staff are providing assistance with a senior resident's activities of daily living. So they're providing frequent, intimate, close contact for eating, drinking, taking personal care of them, and providing care for those residents. And those periods of time allow for the easy transmission of the virus. And that has led to a numerous number of outbreaks across the US and globally. So putting these two factors together, it's resulted in really difficult times and really difficult to control these outbreaks. And this isn't a problem that we've only seen in the US, where over 40% of the deaths have resulted in with COVID-19. We've seen this in Canada as well, where 80% of the COVID-19 deaths are also in care homes. And in Italy, Sweden, and Belgium, even in Europe, we're seeing similar numbers, where a very significant percent of the deaths are to the residents of these communities. So in response to that, our team at CarePredict took a 3-week sprint to develop an entirely new tool set to empower our customers to be able to best control if there is in fact an infection in the community and to mitigate the spread. I always love to dig into some of the details on why we're having such difficulty with this particular virus. And I have an image here. This is from a recent manuscript that we submitted to JMIR Public Health. And it's an outline of some of the fundamental virus characteristics and disease characteristics. And these epidemiological parameters are really central to creating a solution to control the spread in these particular communities. So if you look at the first image, here's your incubation period. We now know it's typically on average around 5 days. There is some variation where you will see a spread anywhere from 2 to 14 days, but on average it's about 5 days. And then you go through a symptomatic period where you see those signature signs like fever, cough, shortness of breath. And during this incubation period, you have a really shortened latent period. And this short 3-day latent period marks the beginning of the infection and the beginning of the infectious period. So here's the big challenge, is someone can be infected and 3 days later show no signs, but be incredibly infectious. And what we found in a lot of the recent reports is that they can be shedding virus at a peak level in their respiratory tract days before showing symptoms. So they could appear to be completely healthy and spreading the virus before they actually show any symptoms. This is very difficult for organizations to control because the normal method is to just test. And we've heard that widespread testing is the solution. Testing is important, however, it requires serial testing because you can see if an individual is in their latent period, the PCR test may show up negative. And then once they enter into this infectious window, then you would see a PCR positive test. So you need to conduct a PCR test, those point tests, on a daily basis in order to capture someone that is infected. We now know that the asymptomatic transmission has become our Achilles heel. There's a recent review article published by Oren in the Annals of Internal Medicine, which demonstrates a very significant number of individuals that are infected with SARS-CoV-2. So they are actually testing positive on their PCR, but do not show any symptoms at all. The CDC has recommended that roughly 40% of infected persons remain asymptomatic, but we see a range, and this is a list of studies here over the past few months, and the percentage of asymptomatic. And you can see it ranges from 25 to 81%. So this silent spread makes it very difficult in senior living communities to, one, identify an asymptomatic individual and ensure that they are isolated and not continuing the spread in the community. One other issue with the asymptomatic cases is that they are equally infectious as the symptomatic cases. So this puts of utmost importance on making sure that we are not just isolating those asymptomatic cases, but in fact testing them and ensuring that they're not spreading it further. So to date, most nursing homes and long-term care communities have been using pretty much a similar arsenal to mitigate the spread throughout a community. They're using symptom-based monitoring. This includes looking for a fever, doing temperature monitoring. 2, they're conducting PCR tests, typically once a week or maybe once every 2 weeks with recent mandates. And then the other arm is manual and even digital contact tracing. So I'm going to provide some detail and color on each of these and the challenges we're seeing. First, symptom-based monitoring. Typically, the signature signs we now know are fever, shortness of breath, and coughing. So if a senior resident is infected with this virus, test positive, they can, and you see these signature signs, you can isolate them and ensure that you're breaking the chain of transmission further. One issue, which is actually unique to this setting, is that many seniors that actually are infected with the virus show unusual symptoms. So they're showing atypical behavior. So they may not have a fever, they may not have a cough or shortness of breath. In fact, what they do show is changes in activity and behavior. They may be sleeping much longer durations or just unusually confused and even falling at a higher frequency. So these are things that we also can pick up with our Tempo wearable device. And the final complication is that we do have a very high incident of asymptomatic and pre-symptomatic transmission. So they are infected, but they don't have symptoms. So the issue here is these carriers can continue to spread the virus and not be isolated. The increase of PCR testing has really improved the situation in senior living and in the nursing homes, but it still has a big window for challenges, and that is due to this window here, in between the latent period and the symptomatic period. The PCR test may show up negative during that latent phase, and so follow-up PCRs need to be conducted. And clearly this is the amount of resources, both human resources and financial resources to conduct these tests daily is actually prohibitive. So really our tools, which I'll go into detail here, are meant to supplement both PCR testing and symptomatic monitoring and augment the staff so they can provide a much better control mechanism. There are also issues in terms of timing. You know, when you conduct a PCR test, it typically takes a few days on average to get the results back. So to play it safe, what we've done is made sure that each of those residents that were exposed were isolated and away from all the other individuals, which leads to other health-related effects through social isolation. The final tool that has been more widespread in other countries in terms of its recent use for COVID-19 is manual contact tracing. And the way that this solution works, it's a very common public health tool. And the way it works is when you have a confirmed case, a public health tracer would actually make a phone call to that primary case. They'll conduct a 2-hour interview, try to identify all of the individuals that they spent time with, how long they spent, and in what location. The issue with this is, one, it does take a lot of time to conduct this manual tracing, and two, in the senior living communities, many of the residents unfortunately are suffering from dementia, Alzheimer's, or memory impairment, and so they may actually forget many of the individuals they had come in contact with over a 14-day period. So now all of those contacts are missed and the virus can be spread further. So manual contact tracing does have challenges in long-term care facilities in controlling that. And humans are running the process. So there are errors both in data collection and then in data processing and in the use of that data. In order to kind of step up to the plate, several big tech companies have developed a digital contact tracing solution, which is run from a smartphone. It uses a Bluetooth chirping between the smartphones to identify how long an individual was in contact with another individual. And the process can work particularly well if the app is downloaded and Bluetooth is turned on. And this is particularly useful for really random incidental contacts in public spaces. There's challenges in trying to use a smartphone-based approach in nursing homes, though. One, the smartphone adoption is very low. You need a smartphone with Bluetooth in order for this to work. And we're seeing that less than 50% of residents in nursing homes and long-term care actually have a smartphone with this capability. And two, the staff also are restricted to not use their smartphones during the workday. So those are innate challenges of using this type of medium. And finally, Bluetooth does have its own limitations in that Bluetooth is a radio frequency and it does transmit very easily through thin walls. So you can see in this picture here where this loved one is visiting with this senior resident, and they may be in close contact, but actually they're separated by this thin window. So the smartphone may say that they actually were in contact, but they're actually outside. So you get a lot of false positives due to that technology. So what we developed is Pinpoint digital contact tracing. So since we already had real-time location and the hardware in place and the wearables being worn by all of the residents and staff, and also wearables that can be given to the visitors, we knew we had the underpinnings of a solution that could tell us in real time how long each individual was spending in the close contact of another. And using that, we built the whole software Pinpoint platform so that the staff can quickly identify if there is an infection, all of the close contacts that were made, and all of the locations that could have been contaminated. And this is a snapshot on how the process works. And our customers have loved this because it's the ease of use. And so, for instance, you have a staff member, Joe, who's infected with SARS-CoV-2. So he is a COVID-19 case. And this person under investigation then would be selected in our CarePredict software. They'd open up a 14-day window. They'd run the software, and within seconds, it would populate each person that Joe came in contact with, the duration, the date, and the exact location. From there, they can go follow up with those contacts, in this case, Larry, Mark, and Susie, see if they're expressing and exhibiting any symptoms, and if it warrants an actual PCR test and also isolation. Susie was in fact identified to be quarantined, and so they stopped the chain of transmission immediately. We've developed some very user-friendly and visualizations for the staff to use in our software, where you have your primary case, the person under investigation here, John Smith, and you see each of the individuals that he spent an extended period of time with when he was infected. So then you can track those people and also see if it's possible that this infected person potentially infected another individual, and actually do tracing for the primary contacts that we've deemed high priority. So this visualization is very helpful for the staff to put together a workflow on how to contain that spread if there is in fact an infection. There's several pieces to this software as well that are particularly useful beyond the contact tracing piece, which is really the most important, given that we know in indoor settings, we're seeing it's possible that there's aerosol-based transmission. And so we want to make sure that if there are individuals in close contact, we identify those and make sure that those contacts are deemed high priority. In addition, though, we have seen in the literature, and several reports have shown that it's possible there is also secondary transmission occurring, from surfaces or foam-like transmission. So if an infected person was in a particular location, maybe playing cards or chess, it is possible those surfaces were contaminated, and then another person came in afterward and actually became exposed to the virus. So our location tracing tool allows us to really trace where that infected person went, where they spent their time, and it feeds right into then the decontamination plan. So if we know that these particular rooms, which we have identified as hotspots, we can go in and make sure we do some deep cleaning and disinfect all of those rooms where the infected person frequented. And finally, this tool was really used in order to control the spread of virus in the nursing homes and long-term care communities. So a colleague of mine, Alyssa Summers, we developed some mathematical models to simulate what would happen, in fact, if there was an infection in a long-term care community of 120 residents. And what we did is we compared our digital contact tracing tool, which is the results are shown in green here, compared to PCR, which is really the go-to conventional tool, and then manual contact tracing. We ran this for this SEER compartmental model for 40 days. And what we demonstrated is at the end of that period, we'd have 10 COVID-19 cases with digital contact tracing, 20 with PCR, and actually 25 with manual contact tracing. So you can see that the performance of this, which is really driven by the speed, we can run this in seconds compared to the delays you see with PCR and manual contact tracing, and the efficiency of our tool. So we basically have yielded 50% less spread and less cases, which is incredibly important when staff are under such pressure as well. And this could result in 2 to 3 fewer deaths if this digital tracing tool was used in combination with both PCR and conventional tools. So the bottom line with that is this can really impact as a mitigation tool to improve the health of the seniors and also increase the occupancy and also the length of stay in your particular communities, especially as we reopen. And several of our customers have had much success with the tool. They actually did a recent report in Reuters where they documented some of the work that we've done with our customers using this tool as really a proactive method. In one of our customer sites, Joe Walter at the Legacy at Town Square said they had concern that someone may have been infected with SARS-CoV-2 and was exhibiting some symptoms. So they then ran our tool proactively and looked at which individuals he had come in contact with, and then waited and isolated those individuals, conducted testing, and then actually the testing came back and that staff member was not infected. But they put those measures in place in the event that the infection did occur and there was the possibility for spread. Overall, Joe and his team at LifeWell at the Legacy at Town Square really found it provided them with tremendous peace of mind and assurance to the staff, residents, and also their families. Because if there is an infection in a community, the family members are sitting on the sidelines waiting, just hoping things can, they get more information and that the resident, their loved one is actually safe. I sincerely thank you for this opportunity to present today. And if there's any questions, if we have any more time, we have time at the end of this now, I'm happy to address those as well.
Hi again, everyone. We does look like we have a few questions that have come in, Jerry. I had one question come in that might have involved an acronym in your presentation. What is SIER? You know that? S, like,
yes. SEER.
Yeah.
It's a type of compartmental model. It's a susceptibility infection exposed recovered model. So it's an epidemiological model, computational model that is used to model the transmission of virus through either a community or the actual population.
Okay, great. We've got another one that has come in. I think this is specifically addressing the Pinpoint solution. Can visitors be traced in this scenario also?
Yes. So visitors are actually given one of our wearable devices, and they can either wear it on their wrist or as a pennant. And so when, if in the event there is an exposed or an infected person, they can actually have that individual's data as well when they come to visit.
Okay, great. And I think on one of maybe the second or third to last slides, you talked about low and high priority, and a question came in about how do you classify high and low priority contacts? Like, what are the criteria involved in that?
Yeah, no, that's an excellent question. With the general population, the literature is showing 15 minutes of within 6 feet or less without PPE. And what we're finding in senior living, it's a much different environment, where you're having typically shorter exposures. So we're seeing less than maybe 5 minutes or so, with that type of frequent close contact is enough for potentially virus transmission. So you can adjust those, but we really are looking at more in the 5-minute period of direct contact, just due to the nature of the work.
Okay, and we have another question that's come in about some costing in terms of room beacons and whatnot. It's something that we might be able to follow up on after, unless it's an easy to answer. It's easy to answer that question.
Yeah, so when we do an installation, we look at the floor plan of the community and make sure that enough beacons are provided, that we actually have the entire floor mapped out appropriately. You know, we don't want any blank spots. And so the number of beacons required is really contingent on the layout of that community. But we typically will put in a beacon in each individual's room. So if they have a bedroom, a kitchen, and a bathroom, they'll have one individual beacon in each of those rooms.
Okay, and we have another question about how easy is it to install?
Very easy install. The only requirement's electricity and Wi-Fi. And so, and our team does these installs. We are very busy these days. So, but yeah, it's a very easy installation. Lightweight installation.
Thank you for that. And we had another question. I assume this means slide presentation ? Means that wondering whether or not this will be shared. I can say from for everyone who has registered for this webinar, you will be receiving the recording. So you will have that at your disposal that you can actually share with colleagues if you like. But I'm sure that we can also ask Jerry if he wouldn't mind sharing some of the information he has provided during this presentation too.
Yes, I'm happy to. And we can send the publications as well that provide more detail on both the outcomes and also on the improvements that we're seeing using digital contact tracing. So both of those manuscripts that are peer reviewed and in process now.
Okay, and I think this is the last one we've got that's come in about using this kind of digital solution for other infections. We're obviously talking about the pandemic and COVID right now, but I guess the applicability to future scenarios where there could be an outbreak of another sort.
Yes, we've really built this tool obviously for this scenario, which is SARS-CoV-2, but in fact there's many other C. diff, MRSA in different environments. And so yeah, this tool can be used to actually control the spread of other infectious disease agents as well.
Okay, unless there are any other questions, I think that is all that we've got for today. So I want to thank everyone who attended today's session. We really appreciate you taking the time out of your busy schedules. And on behalf of CarePredict and Fully Managed, we hope you have a great rest of your Tuesday. Thanks.
Thank you so much.
Bye-bye, everyone.